Hi, my name is Camille and I am a radiology technology student at the Federal Technological University of Paraná in Campus Curitiba. Hello, my name is Fernanda. I am a student of the Radiology Technology course at the Liberal Technological University of Paraná in Campus Curitiba. Hello, my name is Iohana. I am a student in the Technology and Radiology course at the Federal Technological University of Paraná, Curitiba campus. This video about Autism Spectrum Disorder is presented for the Human Anatomy 2 course and for the Stimulus project, both taught by Professor Katia Pruss. Now let's talk a little about Brazilian world statistics so we can understand the numbers and impacts on the increase in diagnosis. According to the Center for Disease Control and Prevention, or CDC, cases of ASD have increased significantly worldwide. In the survey conducted in 2000, it was estimated that 1 in every 150 children received the diagnosis. In the surveys conducted in 2020, this number increased to 1 in every 36 children. In Brazil, it is estimated that there are 100 million people with a diagnosis of autism spectrum disorder. This data shows us how important it is to raise awareness and include people with a diagnosis in society. It also reinforces the importance of actions to combat prejudice. Another important aspect of the disorder is the difference in diagnoses between genders. There is much talk about diagnoses being more common in men, but there is an explanation for this. In men, diagnosis tends to be earlier, usually in childhood, because the signs are more evident during this period. In women, diagnosis is later, because the signs can manifest themselves in a more subtle way, often being confused with other aspects. Therefore, it is important to follow up when we notice something different in childhood. Warning signs in autism are very important because the earlier we identify them, the sooner treatment can begin. Some of the signs are responding less when called by name, even when hearing normally, and lack of or decreased eye contact. They have great difficulty maintaining eye contact with someone. Repetitive movements, also called stereotypies, such as hand flapping and tiptoe walking, are very common. Speech delays, known as echolalia. Some children may have severe speech delays. They also have great difficulty sharing their emotions, making it difficult to express them, which causes difficulty in social interaction. And also hyperfocus. This hyperfocus may be related to a specific topic or activity. Remember that these signs are not a rule and may vary, but it is extremely important to observe if any of them are present. Behavioral traits. Behavioral traits of autism spectrum disorder are associated with communication difficulties, social interaction difficulties, repetitive and restrictive behaviors, difficulty maintaining eye contact, difficulty making friends, common reactions to sensory stimuli, and levels of inadequacy. Levels of support. Autism is classified as Level 1, Level 2 and Level 3. Level 1 has little substantial support. The characteristics are mild and many of them may be difficult to notice the signs, as they perform many functions that a child without ASD of the same age also performs. Level 2, the support is moderate, that is, they need support for specific activities and complex social situations. Level 3, they need significant support and support in daily activities. Their initiative is limited and many of them are nonverbal. They do not speak, and to express what they want to interact, they necessarily require a mediator. Treatment. Diagnosis. Diagnosis is made with the support of a neuropediatrician or psychiatrist, who performs clinical evaluations. There is no specific test to detect ASD. Treatment for autism is multidisciplinary and includes behavioral therapies, medications, and alternative treatments. The goal is to increase the patient's quality of life and independence. Awareness. The UN designated April 2, 2007 as Autism Awareness Month. The goal is to inform the public about ASD and the needs of autistic people, to end prejudice and discrimination. and to recognize the individuality of each person with autism.